Hi guys, Tiffany here, 100 plus. I am jumping on to do a quick update about our beautiful baby TUTI. I'm going to wait for a few people to jump on to make sure that you guys can hear me and see me okay. Hi guys, clear, thank you very much. Okay, there's quite a few people on right now, so I am going to start with the update for TUTI. Unfortunately, it's not a great one. We've had a rough couple days here at the rescue, if you guys have been following, to say the least. But TUTI went home from the hospital, as you all know. We got the urgent email from Miami-Dade Animal Services about TUTI, that she was an owner-requested euthanasia, that she was emaciated and not eating. Well, actually, we didn't know that she wasn't eating at that time. We had no place for TUTI to go, but we saw her photo and knew we had to save her. So we immediately placed our hold and ran down to Miami-Dade to grab her. When they walked her out to me, I couldn't believe my eyes with how small she was. That was my first thought. My second thought, when she got close enough for me to really take a look at her, was I could not believe she was still walking with how emaciated that she was. When I say I could see every single bone in her body, I am not exaggerating. Her ribs were completely protruded. I could put my fingers in between them. Her hip bones were sticking out. Her abdomen area was completely concaved. I mean, she was just basically a walking skeleton. I asked them why the owner decided to surrender her, and they said she wasn't eating. They couldn't get her to eat, and they didn't know what to do, didn't have any money, couldn't take her to the vet or anything. So they surrendered her and asked for her to be euthanized. When I got in the car with her, I looked through her paperwork and saw that the doctor said they had performed an abdominal exam, just pressing on her abdomen like they normally do, and they felt something of a mass. So they didn't know if she had an obstruction, if she had a dead fetus, or something else was going on. So of course I called Amy. She said get her to Blue Pearl. I rushed her to Blue Pearl. They rushed her immediately into the back. Dr. Cannon was on. She immediately got an ultrasound on her abdomen, because they also took x-rays, and the x-rays were a mess. But she did the ultrasound immediately and found that poor TUTI was 100% blocked. 100%. And that she needed to go for emergency surgery. They took immediately her blood gas, her blood work, everything, just to make sure that she was stable enough to go under anesthesia. They pumped her full of fluids, and late that night they got her on the surgery table and removed an entire corn cob that was in her intestines and bowel. They said the surgery was a success. She stayed in the hospital for a few days. She was receiving her antibiotics and her fluids, her pain meds. She also had an upper respiratory infection. But she was released from the hospital 2 days ago. She went home with Zoe initially. And Zoe, as you all know, has quite a few dogs in her house. She has a lot going on right now. So I picked up TUTI from Zoe late last night. When I was leaving the rescue house, she brought her to me, and I took her home to stay with me at my house. So I have a little setup in my room. I'm in my room now. I'll just show you guys real quick. So I have this little area here, completely nice big penned area right next to my bed, so that I could keep a close eye on her, that she is here with me and my babies. Got her here last night, put her in her pen, made her dinner, gave her meds, and she was okay. And she laid down, she was good, and all of a sudden she got up to get some water, and she went over to her water, and I noticed there was a little bit of pink on her pee pads. So I got up and I checked her, and her incision was open. And it was quite shocking, and it was scary. And I picked her up, loaded her in the car, and rushed her to Blue Pearl, called them on the way, said her incision is open and some of her insides are sticking out. So we rushed her to Blue Pearl, and got her in immediately. She was rushed in for emergency surgery again last night. And she's okay. They called and said that she's okay. They had to rush her in for surgery. What happened was, and they said it's very, very, very rare, but it can happen. And TUTI, being in the shape that she was in, she kind of had the perfect storm going on for this to happen to her. Her entire abdominal wall dehisced, which basically meant her body completely and totally rejected her suture material. So the entire abdominal wall, by the time I had gotten her to Blue Pearl last night, was completely opened from the top of the incision to the bottom of the incision. The only thing holding everything in was her skin. And there was a little spot of her skin that had opened, which is where her intestines was coming out of. She said there's only a couple reasons that this happens usually, but being that TUTI was so emaciated, so malnourished, she was anemic, she had a respiratory infection, her blood pressure was very low because of all the other underlying things, and when she went under anesthesia, her blood pressure was going up and down as well. So they said that that is probably the reason that this happened. I am going to show you guys a picture. I'm going to warn you ahead of time that it's graphic, so if you don't want to see it, but I just want to show you. So when I noticed the spots and picked her up, I lifted her front legs up to look at her incision. I will tell you, it was about that big around and only sticking out like this much. It looked like a little knot. By the time I got her to Blue Pearl and was in the car with her in my lap waiting for them to come out, this is what it looked like. So that's our beautiful TUTI. That was her on the way home in the car with me last night before this all happened. And this picture is graphic, guys. I'm just warning you again. That is what she looked like when I got her to Blue Pearl last night. So when I say there was probably only that tiny little tip sticking out when I noticed at my house. By the time I got her in the car and drove her to Blue Pearl, that's how much of her intestines were basically falling out of her body. This poor, poor, beautiful little soul. To say that it was frightening is an understatement. To say that I am heartbroken for TUTI for having to go through all of this again is another understatement. She has been through so much already, from the corn cob and basically having that obstruction and being sick and vomiting and diarrhea. I'm sure that everything that came along with that, and then being starving to death basically, because you don't get that emaciated overnight. So she obviously had not eaten or not been able to eat for quite some time. Then having to go through the abdominal surgery and everything, and the confusion of losing her family and everybody that she knew, to then, I can't even imagine, but I have to believe that was painful when that was happening to her. And having to go through surgery again is just, it's devastating and it's heartbreaking. And I can't believe she's got to go through it again. So needless to say, we had another large bill at Blue Pearl, again, for emergency overnight surgery. They had to call Woolery, the surgeon who did her first surgery, in, because I spoke to Dr. Woolery this morning, and she said when I brought her in, they sent her photos of it, so she was not there. So they had to call her in again late last night. She came in, she opened up little TUTI. She was, of course, worried as well, because I said to her, I get that her body rejected the suture material, but if her abdominal wall rejected the suture material, I'm assuming you used the same suture material, sorry guys, on her abdominal wall as you did on her intestines and her bowel. And if her abdominal wall rejected it, would her intestines and bowel reject it as well? And would they open inside her abdomen? And she said, that's a very good question. You're right, we did use the same suture material, just a different size. But she said because it was a full, oh my God, I keep forgetting the word. Since her abdominal wall was fully dehisced, which means just completely reopened, she took everything out to examine it, to make sure that where she sewed up her intestines and her bowel, that everything was still intact. And she said she tested it and retested it, and everything was secure. Then she, of course, flushed out the entire area, because again, it was hanging out of her, so that is not sanitary. So she flushed it. She said it looked very angry when she got in there and opened it. So she wanted to make sure and go above and beyond with the cleaning and the flushing and all of that. And then she said she put everything back in place, and she closed back her abdomen, and she said she like quadruple reinforced it. So she said if she dehists again, she's kind of going to be at a loss, because like she said, it does happen. It doesn't happen often. It's very, very rare. But she believes because of everything else that poor TUTI has going on, the fact that she was completely malnourished, the fact that she was completely emaciated, that she was fighting an infection in her respiratory system, that she was anemic, everything that she had going against her. and her blood pressure was very low as well, that is what the contributing factor was to this happening to our poor Tootie. I am just so happy that I saw it and noticed it, because I keep replaying in my head over and over again, what if it happened later in the night? What if I fell asleep? What if I didn't notice? And the doctor said if that would have been the case with how fast it happened between me noticing it and what she was like by the time she got to the hospital, she said if it had gone unnoticed by the morning, her entire everything would have been out on the floor. So that is a very, very, very frightening thought. But we are just very, very happy and very blessed that that did not happen. That is not the case. That she was able to make it to the hospital last night. That they were able to call Dr. Woolery in. She was able to have surgery immediately last night. This morning, she is still at the hospital. She is on IV fluids. She's on IV pain medication. She is on IV antibiotics. She is eating. She is drinking. They said she got up in her cage this morning like nothing ever happened. She's a strong little cookie, and we are so thankful that she is. And I just noticed now that my computer screen and my phone is bouncing back on the glasses. I'm sorry, guys, if that was annoying to look at. But I would just want to show you sweet Tootie again. Here is our sweet little Tootie. This was when she was on the way to my house. You could see she was quite comfortable in that cushy bed. And then I am going to show you the graphic photo once again. That is what Tootie looked like by the time I got her to Blue Pearl last night. When I noticed it, it was probably, guys, honestly only like, it's hard to see, let me use my glasses, maybe like that much out, like just a small amount sticking out. And I'm maybe 15 minutes away from the hospital. So by the time I got her to the hospital, that's how much had fallen out of her abdomen. So needless to say, it was an emergency and it was scary as hell. But she is doing well. She has to stay in the hospital again overnight tonight to be monitored to make sure that everything sticks this time, to make sure that there is no more issues with the surgical site. As I said, Dr. Woolery said she quadruple reinforced her abdomen wall this time. So we are praying to God that it's going to stay. But luckily, even though her abdominal wall opened and it was very, very scary, luckily there was no issue with the surgical site in her intestines and in her bowel. We are very, very, very grateful for that, and that it was all healthy and just needed to be cleaned out and sanitized and flushed out. I'm actually going to put these back on, guys, because I think somebody just asked a question, because I saw a question mark, and I want to be able to answer your questions if you have any. And I'm old now, so I can't see without these. Thank you guys for donating. Facebook has this new awesome thing now where you can donate right here on the live video. She was in the hospital. I brought her, guys, last night. She had emergency surgery for the second time again last night, and she is there all day today, round the clock. Doctors, nurses, on IV fluids, antibiotics, pain meds, and they're monitoring her. She has to stay again overnight tonight. She will probably be able to come home with me tomorrow. I would assume probably later in the day, because they're going to want to monitor her as much as possible. And of course, if they think it's not a good idea for TUTI to leave the hospital, then we are going to leave her there for as long as she needs. We would rather her have that round-the-clock care by the nurses and the doctors. If, God forbid, something were to happen, she'd already be there in the hospital with a full staff. So if there is any chance at all that it's not a good idea for her to leave the hospital, then we are not going to take her out of the hospital. Trust me, we are not, you know us, we're not in a hurry to get her out of there if that's the best possible place for her. But again, guys, emergency surgery and calling the surgeon in last night is another big bill for us. Another 48 hours, possibly 72, who knows, hours in the critical care hospital with around-the-clock doctors and nurses is costly. So that is why the donate button is right here on this video. And you could also donate through PayPal. The link is listed there as well. You can send a check, 100 plus abandoned dogs, at 345 East Commercial Boulevard, Oakland Park, Florida, 3334. We, of course, will keep you updated every step of the way, as we always do. We were very shocked and very saddened as I said, we are going to keep her in the hospital for as long as she needs to be in the hospital. I brought her home with me because I do have dogs in my home, but my dogs are very, very quiet. They are very calm. So it's a nice, quiet, calm environment for TUTI. And she would be right here next to my bed with me in the room so that I could see her and monitor her. When I go to work at the rescue house, she'll go with me so I can monitor her there all day. But like I said, if we think that it is better that she is in the hospital, she will absolutely stay in the hospital for as long as she needs. Like they said, it's not a common thing. It's pretty rare. What happened to her, the doctor said we couldn't have done anything any differently. It's nothing that we did. It's just something that happens, and because of everything that was wrong with her, she believes that's the reason her body rejected the suture material, and that it dehisced, and her entire abdominal wall dehisced and was opened. We don't know when it started. Like I said, she had surgery 2 days ago. It could have started from 2 days ago, and by the time last night hit, that's when the entire thing was opened. We'll never know that. But I just wanted to jump on and give you guys an update and let you know what happened, because we haven't been able to jump on today. So I just wanted to let you know what was going on and to ask you guys to please donate. Yes, it is awesome. $700 raised just while I've been talking on this video. That's amazing. Thank you guys, because as we always say, we can't do it without you guys. So I am gonna switch this again. Oops. Again to sweet little TUTI, our sweet little girl who's already been through so much already, had to be rushed in for emergency surgery again last night because her entire abdominal wall surgical site dehisced, and her intestines, stomach lining, and bowel were starting to basically fall out of her body. So thank you guys for donating. towards her second emergency surgery to save her life. We, of course, will keep you posted. I see a couple people asking about Jonah. Jonah is still in the hospital after his surgery. His surgery went well with the 4 discs being removed. He is he is doing well. He's recovering well, but of course, with his surgery as well, he needs to stay in the hospital to be monitored 24 hours a day as well. So that is a very costly surgery, as well as TUTI's. So that is why we beg for money. Thank you all. I see all these people going by. It says that you guys donated, and I am so thankful for you donating. You guys were able to save TUTI's life, not only once, but twice. And she is so thankful, I am sure. This was her yesterday, prior to all of this happening. And again, once I noticed, by the time I got her to the hospital, again, graphic photo, that is what was happening to our poor sweet TUTI, and why she needed to be immediately rushed in for emergency surgery for a second time last night. She is absolutely worth every cent. Yes, you are right. She is recovering. She is eating like a champ, they said. She is up. She is going to the bathroom. But they are going to continue to monitor her all night tonight, overnight. She has her own doctors and nurses. She is on IV fluids, IV antibiotics, IV pain meds. She is fighting an upper respiratory infection as well. But she is doing well. And we are super grateful for her doctors that jumped into action and got to the hospital last night to get her taken care of. And of course, it goes without saying, we are unbelievably grateful to all of you, our amazing supporters, because without you, this is not possible. And we would not have been able to save TUTI's life, not only once, but twice. So I'm going to sign off. I will keep you guys updated as we get more updates on TUTI. I will update you here when she is released from the hospital. Obviously, we will update. And I know that Amy will probably jump on, if not later tonight, then tomorrow after her morning update for Jonah, so that she can give you guys a lot more detail of what exactly is going on with Jonah. But he is doing okay. He is in the care of the neurologist and their dedicated staff, 24-hour care, just like our TUTI. So huge bill there as well. So thank you guys again for helping us save TUTI twice. This is Tiffany, 100 Plus Abandoned Dogs of Everglades, Florida. Can't do it without you guys. Thank you.